So the first thing is disruption of healthcare infrastructure. Hurricanes can damage or destroy hospitals, clinics, pharmacies, and other medical facilities, which limit access to care. Flooding and structural damage may force healthcare facilities to close for extended periods of time. Power outages can also disrupt medical equipment and services. There's obviously an interruption of healthcare delivery, and I've seen that in a number of things, just beyond hurricanes, just any sort of disaster interruption of healthcare delivery. When I was in Sierra Leone for the Ebola outbreak, we were also still struggling to try to get people to HIV care, but everybody was so focused on Ebola for obvious reasons that the HIV care had the potential to suffer. So, going back to hurricanes, patients may be unable to access routine care, medications, or even treatments for chronic conditions. Emergency services and ambulances would be limited due to flooding and road damage. Evacuations can separate patients from their usual healthcare providers and medical records. So these are a lot of the problems that kind of exist in that situation. Of course, Katrina was a major issue here in New Orleans, where I am, and we'll get to that because that was a specific issue between Hurricane Katrina and Rita. But the hurricanes that we've had since then, and we've had a number of them, that tend to, sorry, that tend to interrupt our healthcare systems and the way that we manage health care. I think in New Orleans we've done a great job of figuring these things out. We now have great care within the hospital, so we do this within teams. So if you're on team A, you're obligated to spend the night, which is what I usually do, to allow the other physicians to have their families and they're able to evacuate. Katrina and Rita, which was the hurricane that followed Katrina. Rita was the hurricane that followed Katrina about 3 weeks later, were really obviously devastating for many, many reasons. But where I was assigned to was immediately assigned to the Houston Astrodome, what was then called the Houston Astrodome. I don't think it exists anymore. And I was in charge. I was the medical director for what was the Astrodome Clinic. And so to be in that area where all the New Orleans evacuees had nowhere else to go but to stay within the Astrodome for about 3 weeks, and running that clinic was a very unique challenge, but also one that was very satisfying and one that I'm very grateful that I had the experience to have. A lot of what I saw was mostly skin and soft tissue issues. And that was largely because these were people who were walking through floodwaters. And when we're looking at floodwaters, these floodwaters were also contaminated with a myriad of other irritants, such as gasoline and other things that would be inside waters that would flood a city. So, of course, cutaneous issues, infections, cellulitis, and basically rashes. So it was a lot of steroid creams, and it was a lot of Keflex, cephalexin, which is what I gave either in terms of antibiotics for the cellulitis or for rashes, steroid creams, and sometimes just the both because it was hard to tell the difference between the two. The other thing was trying to get people their medications. Oftentimes, people were evacuating and they evacuated rapidly without taking their medications. I would say that a lot of the New Orleanians that we cared for at that time actually had their medications written down in one way or another, which really surprised me because as doctors, we know that people are like, I don't know my medications. You got them on the computer. But somehow people came very, very prepared. Fortunately, there was a response from one of the big pharmaceutical chains who actually placed a big van immediately there in the Astrodome right next to our clinic. And we were able to get people's Lipitor, their lisinoprils, their basic medications for heart, for cholesterol, for hypertension, for thyroid, the standard the blood thinners, of course, the things that people would need in an emergency. So not necessarily one patient per se, but really a collective of experiences that really culminated in my experience with Katrina. And of course, coming back, the mental health issues that was very, very, very profound. Of course, one of the things that we're seeing with the hurricanes that have happened just recently, I not only feel for individuals for what they're experiencing right now, of course, the disruption in services, the houses that have been destroyed, and I mean, just everything that we know here in New Orleans, what people are experiencing. But the other thing too is the years of not only physical recovery, but mental health recovery that people are going to be experiencing as well. I know that's happening. That's going to happen, and I just feel for those individuals and certainly people who've been through that. I can assure you, we all recognize the empathy and share in that empathy for what they're going to be experiencing moving forward.